TB was the leading cause of illness and death among people living with HIV/AIDS, and large number of multi-drug resistance TB cases were reported every year. Now you might be thinking, what is this MDR-TB? As I said, there are few drugs which is very very important and included in the dots. But what happened, at one step, these bacilli, they are resistant to this drug. They are not responding to the drug. That is the reason why it is very difficult to control and to treat the tuberculosis. The person around the MDR TB patient may get infected as MDR TB patient and not the normal TB. So this MDR is more dangerous than the normal TB because there is resistance to the drug which is actually there for the tuberculosis treatment. So along with this, the India is moving toward the TB free India. The National Strategic Plan for TB 2012 to 17, the goal was universal access to quality TB diagnosis and treatment for all TB patients in the community. As you know, our 80% population in India, they are residing in the rural area where it's very difficult to get the drug in time or diagnosing the person. The person may suffer from, weeks together, having cough since 2 weeks. So then 3 weeks, 4 weeks, that likewise he may be suffering with pulmonary tuberculosis, and meantime the family member also may get infection with the same patient because he is undiagnosed and non-treated. So that is the reason why this policy said universal access, irrespective of the urban and rural area, the TB diagnosis and treatment should reach to each and every person in the community who is having the symptoms of the tuberculosis. Now, these are the National Strategic Plan for Tuberculosis Elimination. Now we are not controlling tuberculosis, but we, India, moving together for the elimination of the tuberculosis up to 2025. RNTCP has released a national strategic plan for tuberculosis for the control and elimination of the TB in India by 2025. According to the National Strategic Plan, TB elimination have been integrated into the four strategic pillars. The pillars are detect, treat, prevent, and build. So, this is the strategic planning for ending the tuberculosis or eliminating the tuberculosis from India. So, this is how the model looks like, that treat, detect, treat, prevent, and last to build. Let's see what is detect. Detect is notification of the TB cases. As you know, in village, the health services in village are the sub-center, primary health center, then community health center, and likewise the cottage hospital, sub-district hospital, and district hospital. But at the village level, who are the health personnel who will identify the cases or notify the cases of tuberculosis? So, Anganwadi worker is there, Asha is there, and the male MPSW also is there, and the person who is there in the that particular village, not in Maharashtra, but village health guide, they are also working in some of the state of India. So these are the local person, these are the grassroots level health professionals. They are responsible for notification of the TB cases, especially the ASHA and female health worker, that is the ANM. So what they will do, they will just survey the village. They will find out the person who is having coughing more than 3 weeks, weight loss, loss of appetite, evening race fever, and they will find out this kind of cases, and they will notify, register these cases. Because to detect, the main objective of detect is registration of these cases. If they register, then only they will get the drugs, that is DOTS therapy, which is directly observed treatment short course at their uh, doorsteps. So this is notification is very, very important. Notification, why it is very important? Because the one should know how many cases are active in that particular village or the particular area. And it is very important for the research purpose. It is important for planning a national program or strategies if at all the cases are on rise. Then next is the Nikshay. What is Nikshay? It is the nutritional support to TB patient. Nutrition play a very significant role as a treatment of tuberculosis. High protein diet, regular diet, various fruits, especially the protein is very, very important to treat the tuberculosis, because the drug client is taking or the patient is taking need a good nutrition. So the Nikshay Poshan Yojana, nutritional support to TB patient, the benefits are financial incentive to rupees 500 per month for each notified TB patient, incentive for the complete duration of anti-tuberculosis treatment to the patient, and the incentive is given via direct benefit transfer. The benefit or the amount or incentive directly will go to their account. So this is very important scheme, because without good diet, this drug DOTS is not having that kind of effectiveness to control and treat the tuberculosis. The next is public private partnership. For detection, we can take the help of other area. For example, if it is a government hospital, if a small primary health center is there at the village, so for survey or for public awareness or the other kind of awareness related to this disease, the nurses as well as they can take the help of the teachers of that particular area or the local doctor or the other person, youth club or the other area who NGOs and all. So it become the public private partnership. So all together they comes and they will plan a various program for ending this tuberculosis, because only public, the area public system means the government is not responsible and not able to eliminate the tuberculosis without the public private and community partnership, that is called PPCP. So that is the reason why intersectoral coordination and public private partnership is very, very important in detecting as well as treating the patient. So this is the next pillar is treat, that is fixed dose combination of drug, which I already also in previous slide it came, and for new tuberculosis cases. So there are two phases. The incentive phase, that is consist of 8 weeks of drug therapy. In that intensive phase is isoniazid, that is INH, rifamycin, parazinamide, and ethambutol. These are the four important drugs comes in the intensive phase, which is consist of 8 weeks, and then comes to the continuation phase, that is three drug fixed dose combination. Rifamycin, isoniazid, and ethambutol are continue for 16 weeks. So this is how the treatment therapy is given to the client. If at all the family, one person is suffering that particular family, so presumptive doses also is given to the other member to the in that family. For previously treated cases of tuberculosis, if at all the person already suffered and again he's showing some symptom of tuberculosis, that means he may be multi-drug resistant tuberculosis patient. So in that case, intensive phase is of 12 weeks, where injection streptomycin is given for 8 weeks along with 4 drugs, INH, rifamycin, parazinamide, and ethambutol. And after 8 weeks, the 4 drug, INH, rifamycin, parazinamide, and ethambutol in daily doses as per weight band are continue for another 4 weeks. So in this case, which is previously treated as a TB, continuation phase is having rifamycin, INH, and ethambutol are continue for 20 weeks as a daily doses now. On the basis of drug susceptibility profile, a standard first line treatment regime can be repeated if no resistance is documented. And if rifamycin resistance is present, shorter regime for MDR TB regime should be prescribed according to WHO's recent drug TB treatment guideline, that is the bedaquiline. That is, bedaquiline also is very important drug, is introduced now for treating multi-drug resistant treatment. Now prevent. This aspect is most important because at this level, if we create awareness in the community, so we can stop the disease at this origin only. So this prevention is very, very important with the objective to prevent the emergence of TB in such susceptible population. Various measures are indicated as scale up airborne infection control measures at health facilities. This means if the client is having tuberculosis and is been admitted in one of the hospital, so in that health facilities only, airborne infection control measures can be taken care of. Means the other patient may not be suffer with the same, or the health professional also may not get the infection with this. So this is very important. So the health facility treating tuberculosis should have the kind of engineering kind of measure to be taken, like how the air is refreshed or fresh, or how it is been free from the droplets, or how the compartment of the other patient is been created. So that kind of measure should be taken, which is observed in Mumbai itself in the Shivdi TB hospital. So they have taken lots of measure for prevention of the airborne infection control, okay, at hospital itself. Then treatment for latent TB patient. If the patient is suffering with tuberculosis or the family member, so what we have to do? We have to test and diagnose the other member in the family also. There might be children, the elders, antenatal mother, or postnatal mother. So we have to take care of everyone and we have to test them. And then, if at all they found positive, then we have to immediately start the treatment for them. If the person is taking treatment, okay, so after this treatment, what happened? Patient feels better after a week. His diet improve, the cough also is been reduced. He is feeling that I am feeling okay now. We already said the alcoholic patient or the immunocompromised patient or the drug abuser, they are more prone for TB infection. And it's very difficult to explain them that this treatment to be taken completely, then only they can be cured from this disease. But what happens, if the person is alcoholic or taking drugs or the other things, he may not listen, and after a week of treatment, he may feel good, and then he will say, "No, no, now I will stop the treatment," and by himself only he will stop the treatment. After few weeks, again he will present with the same symptom, and again he will come to the doctor that डॉक्टर मेरी कुछ हुआ नहीं है, ट्रीटमेंट लिया था, अच्छा लगने लगा, मैंने बंद कर दिया, अभी मुझे वापस ट्रीटमेंट शुरू कर दो. In this case, what is happening, if the treatment is abruptly stopped, maybe incomplete treatment, and the person again gets the infection of tuberculosis, what happened? He may land up in multi-drug resistant tuberculosis because the treatment is incomplete and now he becomes the resistance. This bacilli which is there, or the disease which is already infected him and might be his family, they will not respond to the drug which is already there for the treatment of tuberculosis. You can imagine what will happen. And now this drug is introduced, but multi-drug resistant tuberculosis, if not treated, it will land up in the death only. That is the reason why, while providing treatment or the DOTS therapy to the client, we have to tell them, ये आपको अभी शुरू किया है, जब तक डॉक्टर ना कहे आपको बंद करना नहीं है. एक भी डोज आपको मिस करना नहीं है, और इसके साथ में आपको बराबर फॉलो अप करना है। उसके बाद में अच्छे से खाना खाना है, और उसके बाद में जब डॉक्टर क्लिनिक में बुलाए आपको आना है। अगर आप बीच में बंद कर देते हो तो इसके बाद में आपको क्या हो जाएगा, मल्टी ड्रग रेजिस्टेंट ट्यूबरक्लोसिस हो जाएगा, जिसका कोई भी इलाज नहीं है, और आपको उसके बाद में डेथ हो सकता है। आप अपने साथ साथ आपके फैमिली के भी लाइफ डेंजर में डाल रहे हो। सो दैट वे वी हैव टू encourage patient, guide them, counsel them for compliance to TB treatment. Compliance means the complete treatment he is supposed to take. If at all the client at the initial stage is counseled well, if he is taking treatment for a particular period of time as a intensive phase and continue phase, okay, if the diet is good, if there is a ventilation, cleanliness, and he's taking enough rest, he's doing little bit of exercise, then this disease is totally will come under the control and can be prevent to the other member of the family or in the community. Otherwise it will land up in multi drug resistant tuberculosis. And you have seen the gravity in my earlier slide, that how many patients, how many person, how many families are dying with the disease in India. So address the social determinants of TB through intersectoral approach. Okay, so we have to take help of the other sector also, maybe the water supply, sanitation. Okay, then in Mumbai itself, the BMC. Okay, nursing colleges, medical colleges, NGOs. They all have to come together and to address the social determinants. Maybe in the slum area, Mumbai slum, or the other area, and we have to create an awareness about this disease and its preventive measures.
Madam, sorry for interruption. Madam, are you sharing your slides, PPT?
Yes, sir.
I think we're not visible, madam. Can you check it?
Is it not visible to each and everyone?
I think it is not visible, madam. Shashank?
But I am.
Yes, sir.
No,
it is not visible. I thought that you were speaking extempo like that. But it is not visible.
Shashank, please help us, madam, how to share.
I shared all my slide. Just a minute, sir.
Yeah.
Just a minute. Is it okay?
Yes, ma'am. Yes, ma'am.
Yes, now it's okay.
But you should have told me so earlier. So
Yeah, that
Now
you
it
need.
is okay.
Yeah.
okay. So we are talking something about the prevention of tuberculosis, and now let's move to the social awareness. So respected our director, sir, so today's program is as a part of social awareness of tuberculosis, because this is very important aspect. We have to make community aware about this disease, its causative factors and its prevention. So social awareness is very, very important. Airborne infection control measures are also very important, which I told you earlier, that it should be there in the health facilities level as well as it should be there in the community level. If at all the prevalence of this disease is there in particular area, so we have to teach the people about the cough hygiene. So they have to cover their like how it was during the COVID. That way we have to teach them, and you have to tell them like the cough hygiene is very, very important to prevent the infection. Then contact tracing. So contact tracing also was very important during our COVID. If someone comes to our contact, so they used to trace the contact. Same here. If at all the family member is staying together and one person is already suffering with the tuberculosis, so the person who comes in contact with that patient, or who already were there and now he is not there, so that person supposed to trace, and the treatment supposed to start to him after the diagnosis. Then BCG vaccination. That vaccination, it is given at birth to the children. So we have to create the awareness in the society for the BCG vaccination. Addressing social determinants of tuberculosis, that I already told you, that slum area, or if the ventilation is not there, if lighting is not there, because ultraviolet rays itself is having a quality of killing this bacillus. So if at all the room is very congested and dark, and there is no light, and so much congestion is there in that particular area, there may be chances of getting the tuberculosis more comparing to the other area. Now, what is build? So building means capacity building. Health system strengthening for TB control under the National Strategic Plan 2017 and 25 is recommended in the form of building and strengthening, enabling the policies, empowering institution and human resources with enhanced the capacity. So capacity building is very, very important, maybe at the community level, maybe at the institutional level. Community level, I said, the public, private, and community partnership, intersectoral coordination for creating awareness regarding tuberculosis, and at the institution level, we have to build the capacity of the health worker for this disease, like how to trace, how to detect, how to prevent, and regarding the DOTS therapy. So that way the different programs are going on for capacity building at both the level, and it should be continued. Now to conclude this, because a few of the slide which is missed, so I would like to just show the slide which was missed by the people. So let's have, so this was my first slide. This was visible. Okay. This global burden of TB cases I explained, because it is a very, very deadly disease. Okay, and 10th cause of death worldwide. Then Indian scenario also explained that 480,000 Indians every year, and more than 1,400 every day are killing by tuberculosis. So explain about the tuberculosis. These risk factor, I explain you what are the risk factors. Sign and symptom of active tuberculosis: coughing for 3 or more weeks, chest pain or pain with breathing or coughing of blood or mucus, unintentional weight loss, fatigue, fever, night sweats, chills, and loss of appetite. These are the investigation has been explained. History is very important. Clinical examination, Montos or tuberculin test, X-ray, chest, or for other area tuberculosis, if it is there in the body, MRI also is suggested, and sputum test. These are the common drugs which comes under the DOTS is explained. These are the end TB strategies of Government of India. And this is the National Strategic Plan for Tuberculosis Elimination. Detect, treat, prevent, and build. So explain about the notification of the TB cases at the grassroots level. Nikshay also has been explained. It is a nutritional support to TB patient, and they get the incentive of rupees 500 per month. Public-private partnership. This is the DOTS, fixed dose combination treatment, to treat the intensive phase of 8 weeks and continuous phase of 16 weeks. Then prevention also we have seen, the scale of the airborne infection at the health facility level, treatment of latent TB infection, compliance to TB treatment, which is very, very important to prevent the multi-drug resistant tuberculosis. Social determinant to be addressed through the intersectoral coordination. Social awareness, airborne infection control measures at the community level. Contact tracing, BCG vaccination after birth, addressing social determinants of TB. To conclude this, the global public health and TB community is shifting its focus from control of TB epidemic toward elimination. India has committed to end TB and is at a critical stage, with the national momentum expected to accelerate after the increased political commitment and the heightened community awareness about public health and hygiene, and the treat of communicable disease following COVID-19 pandemic. So everyone become health aware after the pandemic, and now we are moving towards the ending TB or elimination of tuberculosis through the public, private, and intersectoral coordination. These are some of the references which is taken from Government of India's site and WHO site. And this is हार कर भी वो हारते नहीं, जो हृदय से उत्साह को मारते नहीं, जीत उनकी निश्चित होती है जो मुसीबत से डरना जानते नहीं. एंड टीबी एंड सेव लाइफ. It is our responsibility to create awareness and support this End TB and Save Life campaign of Government of India. Thank you so much. Thank you, sir.
Thank you very much, ma'am. Now I request our Assistant Engineer Director, Dr. P. Namudripal sir, for formal vote of thanks.
Fine. No? Any student want to ask the questions?
Before that, as directed by our sir, so number of students have joined us, especially nursing students, I think. So अगर किसी को कुछ पूछना हो, मैम यहाँ पे हैं अवेलेबल अभी इस टॉपिक से रिलेटेड, तो वो अपने आप को अनम्यूट करके मैम से कुछ क्वेश्चंस पूछ सकते हैं, इंटरैक्ट कर सकते हैं.
Now, this is the great opportunity where you are going to have the interaction with the expert. Because of I also learned so many things from our presentation, where it is a very important one, where total country, as per our Honorable Prime Minister slogan and the call, we are combating with this, which is a very high risky disease, where everyone has to join together and fight against this one. In that way, we all should be aware. And that's why I request all the students, most of them are the students, you can ask any questions related to this topic.
हेलो.
Yeah, Sanjay, please.
हाँ मैडम, मैं एक सवाल पूछना चाहता हूँ कि इसका ट्रीटमेंट, इसकी मेडिसिन लेने के बाद में मान लीजिए 1 ईयर या 2 ईयर हो जाता है, उसके बाद भी कुछ इसका टेस्ट वगैरह हमें करवाना चाहिए क्या, कि अभी भी उसके कुछ लक्षण या उसके जो है वो कुछ, मतलब ये कैसे कंफर्म हो कि अभी हम उसमें नहीं है?
ओके, देखिए जब आपको ट्रीटमेंट स्टार्ट करते हैं डॉक्टर, तो वहाँ पे बोल दिया जाता है कि आप ये जो ट्रीटमेंट है आपको कितना महीना तक लेना है. फॉर एग्जाम्पल इंसेंटिव फेज है, आपको 8 वीक्स तक ड्रग लेना है, उसके बाद में 2 महीने तक लेना है. उसके बाद में इफ एट ऑल, इट इज डिपेंडिंग ऑन विच साइट ऑफ ट्यूबरकुलोसिस इज हैविंग. कौन से साइड में, एक्स्ट्रा पल्मोनरी है, पल्मोनरी यानी लंग्स के बाहर में भी बोन में रहता है, स्पाइन में रहता है, में रहता है, if at all your treatment started and you are feeling better and the course of treatment is already completed, अगर वो लंग्स का ट्यूबरकुलोसिस है तो उसके बाद में टेस्ट करना है, उसका एक्सरे बताएंगे कि एक्सरे करना है, उसके बाद में पता चलता है कि व्हाट इज द स्टेटस ऑफ लंग. ओके, उसके बाद में अगर डॉक्टर को कुछ एक्स्ट्रा पल्मोनरी ट्यूबरकुलोसिस है तो उसको, अगर इफ एट ऑल यू आर नॉट और द पर्सन इज नॉट रिस्पॉन्डिंग टू द ट्रीटमेंट, एक पूरा 2 महीना हो गया है, 6 महीना हो गया, तो कुछ फर्क नहीं पड़ रहा है, तो उसके बाद में लाइन ऑफ ट्रीटमेंट चेंज हो सकते हैं. और बाद में और कुछ प्रॉब्लम है तो अदर इन्वेस्टिगेशन आल्सो कैन बी एडवाइज. उसके बाद में फॉलो अप बहुत जरूरी है. उसके बाद में जो है आपका क्लिनिकल टेस्टिंग एज वेल एज इन्वेस्टिगेशन जरूरी है.
ओके, इसका एक बार ये कंप्लीट हो जाने के बाद में डॉक्टर अभी बोल देते हैं कि अभी ये मेडिसिन जो है वो आप बंद कर सकते हैं
जी.
तो इसके बाद में ये वापस होने के कुछ चांसेस होते हैं क्या कि 5 ईयर या 10 ईयर के बाद में, या कुछ ऐसा कुछ होता है इसका?
देखो, इट्स ऑल पेशेंट, एनीबडी, हम लोग सब जो है हाई रिस्क है, हम में से सबको कभी भी हो सकता है ये बीमारी। इट इज टोटली डिपेंडिंग ऑन आपकी लाइफस्टाइल क्या है, आप खाते क्या हो, गुड न्यूट्रिशियस फूड है, आपकी इम्यूनिटी कितनी है, आपका जो लाइफस्टाइल है वो कैसा है, उस पर डिपेंड है। और अपना अगर इम्यूनिटी अच्छी है तो वो वायरस है, जो बैसिला है, वो तो सब हवा में है, इट इज सस्पेंडेड इन द एयर। तो जिसकी इम्यूनिटी कम है, जो अपना बराबर से हेल्थ का कॉन्शियस नहीं है, तो उनको हो सकता है ये। मगर ऐसा नहीं है कि आपके ट्रीटमेंट के बाद में आपको वापस होगा ही, ऐसा कुछ नहीं है। ऐसे बहुत सारे क्लाइंट है जिनको 30 साल पहले, 25 साल या 50 साल पहले ट्यूबरकुलोसिस हुआ था और अभी हेल्दी है। ऐसा कुछ भी नहीं है कि उनको वापस हो जाएगा। मगर अगर आप वही रास्ते पे चल रहे हो, वही कंजेस्टेड एरिया में रह रहे हो, वेंटिलेशन नहीं, लाइट नहीं है, खाना नहीं, एक्सरसाइज नहीं, इम्यूनिटी कम है, ये सब बातें अगर हो रही है बार बार, तो नॉर्मली हो सकता है। ऐसा नहीं वो पहले वाला ही वापस आ रहा है, दूसरा फ्रेश इन्फेक्शन हो सकता है।
ओके, थैंक यू मैम।
ओके, हाँ।
Any other students?
Okay, sir.
Yeah, thank you, thank you. Yeah, it is a good, wonderful lecture, informative and all the things. Shashank, you can go as per the formal program schedule.
Yes, sir. I'm sorry, because of technological issue that slide were not visible, so I was not knowing that.
No, but anyhow, we are going to upload this lecture
Yes,
in
sir.
our YouTube channel,
Yes,
where
sir.
we are having 5,000 subscribers
Yes, sir.
in our RC Mumbai YouTube channel. It is very informative and useful one, where it creates some awareness among the students or other population also, because of so many are following our IPNO, then it will be posted in our social media also. It is all part of our awareness.
Yes, sir.
Anyhow, thank you, madam, for spending your valuable time and delivering this lecture.
Yes.
Shashank, you go ahead.
Yes, sir. Yes, sir. Thank you very much, sir. So proceeding further, now I request our Assistant Regional Director, sir, to give formal vote of thanks. Due to some technical issues, sir will be using the phone.
Thank you. First of all, I thank our today chief guest and our special invitee, Dr. Nilima Sonamane. Madam, on behalf of IGNO Regional Center, so we thank you because a wonderful session you did it. So I think the purpose, what the purpose of organizing today this lecture, it is fulfilled. I think those who are attending this virtual meetings today, I think they got the point. So it's very systematically you are presented. I observed that from basic to the what is TB, then what is the scenario when that prevention strategy started from government side and all these things, and now where we are and what we have to do. So such a wonderful manner you have presented. So definitely I feel that it will reach the public through our participants. So once again, I thanks a lot to you, madam, on behalf of IGNO Regional Center and my regional director and all other staff. I thank you, and also those who are attending this meeting. Once again, I thank you, all of you also, through our IGNO Regional Center. With these things, I think we can conclude this meeting. So I hand over this to Susan.
Thank you, sir. Thank you.
Thank you very much, ma'am. So now, with the permission of our regional director and our guest, we may now close this session. Thank you very much.
Thank you.
Thank you, sir. Thank you, ma'am.
Thank you, ma'am. Thank you, sir.
Thank you, sir.
Thank you, madam. Thank you, sir.
Thank you.
Thank you, ma'am. Thank you, sir. Thank you, ma'am.
Thank you, ma'am. Thank you, sir.